Benadryl overdose in dogs, a veterinary discussion on 5 symptoms and what to do next. While it's known that some human medications can be administered to dogs, it is crucial to never give any medication to your pet without first consulting with your veterinarian about its safety and proper dosage. Dogs metabolize medications differently than humans, which means they can be more sensitive to certain drugs and may require higher doses for others. Benadryl, which is a brand name for diphenhydramine hydrochloride, is one of the medications that can be used in dogs to treat allergies and motion sickness. However, convincing dogs to take medication can be challenging, and certain liquid or chewable forms, especially those flavored for children, can be quite appealing to dogs. This can put you in a situation where your dog has ingested too much Benadryl, whether by accident or by your suspicion. The first thing to do is to remain calm. In most cases, a higher dose, possibly even double the recommended amount, will be tolerated relatively well, as long as it was a one-time event. However, at very high doses, this drug can cause serious health issues, and in some cases, even death. Your first point of contact should always be a pet poison hotline or a veterinarian. If it's outside of regular business hours, do not delay in seeking advice and treatment. There are always emergency contact numbers or online veterinary consultations available. Continue reading for more information on Benadryl overdose in dogs, how to recognize signs of overdose, and the steps you should take next. What is Benadryl? Benadryl is the most common brand name for diphenhydramine hydrochloride, a type of H1 antihistamine. This drug works by blocking the effects of histamine, which helps reduce allergic reactions like itching, redness, and hives. One of the most common side effects reported by humans is drowsiness, but this effect can vary in intensity in dogs. Benadryl comes in various forms, including tablets, gel capsules, chewables, and liquid forms. Is Benadryl safe for dogs? The safety of any medication will depend on the dog's age, breed, and overall health. This is why it's always best to consult with your veterinarian before giving any over-the-counter medication to your pet, especially those intended for humans. Generally, Benadryl is considered relatively safe for dogs when given at the correct dosage. It can be used to treat allergic reactions from environmental allergens, motion sickness, and even as part of the treatment for mast cell tumors. It is especially useful for long car trips, as it helps with nausea and has a sedative effect. What is the recommended dosage of Benadryl for dogs? The recommended Benadryl dosage for adult dogs is 2-4 mg per kilogram of body weight, 0.9 to 1.8 mg per pound, every 8-12 hours, as needed, usually 2-3 times within 24 hours. It is always advisable to start with a lower dose and only increase if necessary. Liquid forms of Benadryl are ideal for smaller dogs, but they can be impractical for larger dogs due to the volume required. Important note, if using the liquid form of Benadryl, ensure that it does not contain xylitol, an ingredient that is extremely toxic to dogs, even in small amounts. What happens in case of a Benadryl overdose in dogs? While some human medications can be given to dogs under the proper guidance of a veterinarian, it is critical to always check the safety and dosage requirements beforehand. Dogs metabolize drugs differently from humans, making them more sensitive to certain medications and requiring different dosages than humans. Benadryl can be used to treat allergies and motion sickness in dogs, but if they ingest too much, it could lead to an overdose. In such cases, it's important to stay calm. While it may be concerning if your dog has consumed a high dose, in most cases, the dog will be fine, especially if the overdose was not extreme. However, a significant overdose can lead to severe complications, even death. In general, overdose symptoms typically appear when a dog consumes around 6 times the recommended dose of Benadryl. More severe symptoms and effects are usually seen after consuming 10 times the normal dosage. For instance, if your dog accidentally ingested double the normal dose, they are likely to be okay. But if your dog consumed an entire bottle or package, They could experience severe symptoms of toxicity. Recognizing overdose symptoms. 1. Hyperactivity or agitation. As the dose of diphenhydramine increases, it starts to affect the central nervous system, leading to a shift from sedation to excitement and restlessness. Your dog may become jittery, hyperactive, and show aggressive behavior. 2. Dry mucous membranes. Dryness or stickiness in the gums may indicate dehydration, but it can also signal an overdose of Benadryl. If your dog's mouth feels unusually dry, it's time to contact your veterinarian. 3. Dilated pupils. Enlarged pupils, especially in bright light, is a clear indicator that something unusual is happening. This is one of the telltale signs of diphenhydramine overdose. 4. Disorientation or confusion. Your dog may exhibit signs of disorientation, such as walking in circles or acting confused. This could be due to the stimulation of the central nervous system or the adverse effects of the drug. 5. Fever. A fever, which is a high body temperature, can indicate inflammation. If you suspect that your dog has a fever, you can check their temperature. Normal rectal temperatures for dogs range between 100 and 102.5 degrees Fahrenheit. If you notice that your dog's ears and nose feel warmer than usual, it could be a sign of a fever. If your dog is displaying any of these signs after ingesting Benadryl, you should contact your veterinarian immediately for guidance. Treatment for Benadryl overdose in dogs. Treatment for Benadryl overdose will depend on how much the dog ingested and how much time has passed since ingestion. The following methods may be used to treat an overdose. 1. Inducing vomiting. If the overdose occurred within a short period, the veterinarian may induce vomiting to prevent further absorption of the drug. 2. Activated charcoal and laxatives. Activated charcoal may be administered to absorb any remaining drug in the stomach. Sometimes, a laxative will be used in combination with activated charcoal to help the dog pass the substance quickly. 3. Intravenous fluid therapy. In severe cases, intravenous fluids may be administered to help maintain hydration and support organ function. Most dogs respond well to treatment and recover fully with proper care. What about other forms of Benadryl? Some types of Benadryl, such as Benadryl Plus or Benadryl Congestion, contain additional ingredients, like phenylephrine, which should never be given to dogs. If your dog accidentally ingests these forms, it's essential to seek immediate veterinary attention. The potential side effects of ingesting phenylephrine include agitation, hyperactivity, dilated pupils, rapid heart rate, high blood pressure, anxiety, tremors, elevated body temperature, head shaking, vomiting. Final thoughts. Benadryl, diphenhydramine, is a relatively safe medication for dogs when given at the appropriate dosage, but it's important to always check with your veterinarian before administering any medication intended for humans. While it can be helpful for treating allergies and motion sickness, there are risks associated with overdose, especially in cases where the dog consumes 6-10 times the recommended dosage. The most common side effects of Benadryl include fast heart rate, rapid breathing, drowsiness, and excessive drooling, but in the case of overdose, dogs may show signs of hyperactivity, dry mucous membranes, dilated pupils, fever, and confusion. If you suspect your dog has overdosed on Benadryl, it's likely that they will recover with proper treatment. However, it's always safest to consult with your veterinarian or contact a pet poison hotline to ensure your pet's well-being.